In many instances, patients with intellectual or developmental disabilities, often referred to as IDD, may have heightened sensory sensitivities related to the ears, nose, or throat, or to certain sounds, tastes, or smells. As a result, ENT-related procedures and diagnostic tests can be especially aggravating. A nonverbal patient may need a hearing test to rule out an underlying cause of speech delay, or a patient with unexplained behavior or difficulty hearing may be experiencing ear infections or have earwax buildup. In these cases, alternate diagnostic procedures such as otoacoustics emissions testing or auditory brainstem response testing or exams under anesthesia may be required. The IDD nurse navigator can be helpful in coordinating these efforts. Another important consideration when treating IDD patients is self-injurious behavior, or SIB. SIB is relatively common in individuals with autism spectrum disorder and can manifest in various forms, including headbanging, biting, scratching, or hitting oneself repeatedly. This behavior is often linked to difficulties in communication, sensory processing issues, anxiety or frustration, and is a method of coping with emotional distress or as a means of expressing intense emotions that are difficult to verbalize. These actions can result in damage to the head, ears, face, and even hearing loss. Repeated trauma to the ear can cause blood to build up under the skin of the outer ear, forming a hematoma. If not treated in a timely fashion, this can cause permanent deformity to the ear once scar tissue develops, otherwise known as cauliflower ear. The hematoma needs to be drained promptly in the emergency room or by an ear, nose, and throat physician, either in the office or the operating room, depending on the patient's ability to cooperate. Given the heightened sensitivities of many IDD patients, some individuals may insert foreign objects into the ears. This behavior can be a result of sensory seeking or self-stimulation or lack of awareness of potential harm. It's essential for caregivers to be vigilant and take preventative measures to ensure the safety of the individual, such as closely monitoring the environment. If a foreign body is suspected in the ear, prompt medical evaluation is necessary to avoid the potential complications. A foreign body in the ear can sometimes be removed in the office by an ENT doctor, but other times will necessitate an exam under anesthesia. It's important to recognize and address the unique challenges of individuals with IDD. Through early detection, tailored interventions, and interdisciplinary collaboration between healthcare professionals, we can optimize the quality of life and well-being of individuals with IDD.